Hello, myself Dr. Manish Mahajan, Senior Consultant from Nephrologist Group of Hospital as well as in Moradabad. In today's session, we'll discuss chronic kidney disease or CKD and its association to pedal edema along with its causes, symptoms and treatment. First, let's see what is CKD, chronic kidney disease is. The continuing and permanent degeneration of the kidneys is known as CKD. By CKD, I mean chronic kidney disease. The kidneys are a vital organ in the human body. They serve a variety of purposes, including maintaining the body's mineral and electrolyte balance, assisting in the production of red blood cells as well, maintaining the acid-base balance of the blood, and excreting water-soluble waste. Kidneys that have been damaged lose their capacity to execute all these functions. As we are talking about, chronic kidney disease, so first we have to understand what are the stages of chronic kidney disease. There are 5 stages of chronic kidney disease. In CKD stage 1, the kidney functions normally with more than 90% of the kidney functioning properly. In stage 2, the kidney function mildly decreases to 60 to 89%, while in stage 3, it decreases up to 30 to 59%, and the function decreases from mild to moderate. In CKD stage 4, the kidney function severely decreases to 15 to 29%, while in CKD stage 5, the patient lands into the dialysis and the kidney fails to function properly, and the patient requires renal transplant or the dialysis. Since the kidney can compensate for the loss of functions, symptoms may not appear until permanent damage has occurred. Some of the commonly observed CKD symptoms, depending upon the severity, even we say uremic symptoms, are swelling of the feet and ankles or pedal edema, nausea, vomiting, lack of appetite, sleep problems, urinating more or less, diminished mental sharpness, patient becomes lethargic as well, weakness, muscle cramps, high blood pressure. The blood pressure might jump up to 160, 180, and at times it can even cross 200. Shortness of breath, the patient becomes dyspneic due to fluid overload. As we are looking at the signs and symptoms of CKD, one of the major symptoms, which is pedal edema, which we are going to discuss right now, it is a swelling of the feet and ankles caused by an abnormal build-up of fluid in the ankles, feet, and lower legs. Edema of the foot can be caused by 2 different mechanisms and can happen in unison or separately. And even the patient may present you as pedal edema, and pitting edema, as well as the patient also may present to you in a sarca form, while whole body generalized edema as well. So let us see how is pedal edema linked to chronic kidney disease. Edema forms in the patient with chronic kidney disease for 2 reasons, either due to heavy loss of protein in the urine, which we even call nephrotic syndrome. In that case, you may also find creatinine level quite normal, or the creatinine level raised as well. Impaired kidney function. So when we are talking about heavy loss of protein in the urine, the generalized term what we use in our field is nephrotic syndrome. The nephrotic syndrome is defined as a significant loss of protein in the urine along with the edema. A decrease in the protein called albumin in the blood results in reduction in the fluid in the blood vessels. Generally, when you do urine routine, you may find albumin 2+, 3+. That is where you actually detect loss of protein from the urine and from the blood. The kidney then detects a decrease in blood volume and attempts to retain salt. As a result, fluid collects in the tissues, resulting in edema. Pedal edema can also occur when someone stands or sits in the same posture for extended periods. The symptoms of pedal edema include swelling and puffiness of the tissues just beneath the skin. Also, you can also see puffiness of face as well. Skin that is stretched or shiny. Skin that retains a dimple or pits after being pressed for several seconds, what we call a pitting edema as well. When you press that particular skin on the leg, it goes in. Let's take a look at ways to reduce pedal edema caused due to chronic kidney disease. Treatment for edema includes addressing the underlying cause. lowering the salt intake, of course, and in many cases, using a diuretics to eliminate excess fluid. Generally, as we know, dietary is a very common word in the Indian health scenario. Everybody knows dietary, so we generally use different doses of dietary depending upon the edema that a patient has. It may also be beneficial to use compression stockings and elevate the legs. One, reduce salt intake. As I just said, it is a very important part of reducing the edema. Edema can be exacerbated by sodium, which is present in table salt, processed food. Reduced salt consumption can help in minimizing edema, especially if you are on a diuretics. You can always, ask a patient to reduce salt intake, have less pickles, and outside processed food like chips, which contains high salt content. And the second one is use of diuretics. Diuretics are drugs that induce the kidneys to eliminate more water and salt, hence reducing edema. Because eliminating too much of fluid too rapidly can drop blood pressure, so it causes lightheadedness or fainting and damage kidney function. Thus, diuretics must be administered with caution. You have to observe patients so that the patient doesn't become dehydrated as well, and due to excess loss of fluid. So the dose of dietary or the diuretics has to be adjusted accordingly depending upon the edema. And the third one is compressing stockings. Compression stockings can be used to both prevent and treat leg edema. Although good measuring and fitting of the stockings can limit the risk of discomfort, certain stockings can cause skin irritation and pain. Effective compression stockings exert the most pressure at the ankle and progressively decrease the pressure of the legs. And the fourth and the most important is also the body positioning. Elevating the legs above heart level for 30 minutes 3 or 4 times a day can help with leg, ankle and foot edema. Additionally, elevating one legs multiple times a day may not be feasible for individuals who are working. Lastly, it is not always possible to prevent CKD, chronic kidney disease. Controlling and reducing the progression is very important. Controlling disease like high blood pressure, diabetes, on the other hand, can benefit chronic kidney disease. Can also benefit the kidney from benefit the patient from developing edema. And if you are at high risk for the CKD, you should get regular testing. Early detection of chronic kidney disease can lead to slow its progression. Limiting salt intake, choosing foods with low potassium, and having physical activity that can help with reducing pedal edema caused by chronic kidney disease. Thank you.